Good morning, everyone. It's such a pleasure being here. I'm so honored by the invitation. Thank you, Dr. Gina, Dr. B, and all the faculty for having me. First of all, I want to introduce myself. My name is Matheus Arantes, and for where I pointed it. This way? Yeah. I'm not the kind of PowerPointing guy. I'm on the old way. I like to write my notes. So sorry about this. But I insist on don't. Okay. Okay. So my lecture today is about facial harmonization and functional beauty. And first of all, I want to discuss something with you. It's about the name of this. Facial harmonization and the functional beauty. Why the name of my technique is functional beauty? First of all, I want to talk about what beauty means. So we work with beauty. So it's important to us to understand what beauty means. Beauty changes with time. The concept of beauty changes, right? But there's something on beauty which do not change with time. And it's the experience of beauty. And I want to talk a little bit about this kind of beauty. The experience with beauty, the glad we have when we have the contact with beauty, this do not change with time like the concept of beauty. Once you see someone and you agree that someone is beauty, you are telling that you have the experience of satisfaction seeing or hearing that someone. So this is my space in São Paulo. Which one of you want to visit it? I have a new space in Brazil for continual medical education, and I'm glad to show this for you. So let's go. It's a delay here. Okay. Facial harmonization with functional beauty. I'm going to start to use FB for functional beauty right now, okay? Facial harmonization is a technique that I created to harmonize the face. Actually, functional beauty, okay, is a technique I created to harmonize the face with fillers, and which I have been developing since 2013, using the combination of fillers and Botox. And fillers and Botox have something in common, that is the power of re-educating muscles. Yes, fillers and Botox, we use both for re-educate the way the muscles, the mimical muscles works on the face. Once we understand that the aging process changes the shape of the face, this changing of the form carries a changing of the muscle's function. And sometimes we evaluate the anesthetical complaint of our patients just looking for the muscular function. And we need to realize there's always a changing on the form, on the shape, carrying the changing of the muscle function. And the relation of the function and the anesthetic aspect is the point of this class. We need to realize there is a cross between function and aesthetics points. So, what is the functional beauty technique about? It's about finding a balance in between the proportion of the facial structures by reshaping points. So once we understand that all complaints of our patients came from a changing of the form of the shape, and all the anesthetic hyperfunction or hypofunction of the muscles came as a result of a shape changing, we understand that to treat the function and to treat the aesthetics points, I need to change, to work on the form. So, because of it, reshaping points by myomodulation, okay? Myomodulation is basically the re-education of the muscles. Once I have the behavior of the muscles changing because of the form, I need to understand that I can optimize the way it works by changing the form. So I have the myomodulation by directly function when I block the function with the toxin botulinic, with the Botox. And when I create resistance for the muscle contraction, like when I put some filler in the way the muscle contract, I create resistance for this. Then I change the way it works. I will explain myself better in the next point. So, what does facial harmonization mean? Creating and enhancing beauty by improving the proportions between the facial structures according to the patient's needs. So that's the point. Find out what patient needs, and sometimes it is different what patient needs and what patient wants. So nowadays, if we can like contouring the face, how beautificate would be like Mona Lisa, right? That's a good example for contouring the face. So, what is functional beauty? It's a technique to harmonize the face. So, I want you to remember that harmonizing means balancing. Always when I'm thinking about beautification, I need to think about this word, balancing. Balancing of the proportions and balancing of the function. Everything that is too much polarized, like too much function or too less, is an aesthetic. The aesthetic experience that we have, that pleasure we felt when we have the contact with something that we accept as beauty, is related to the balance, the plenitude of something. So, I'm gonna use fillers and Botox for this, and my kind of fillers for face is hyaluronic acid. And contouring the face by re-educating mimical muscles. How re-educated, Matheus, and are you talking about fillers? For example, when you are growing old, remember that I said the aging process is a reshaping process by absorption, and it changes the way the muscles works. So you can see this easily when I'm analyzing a smile. When we are growing old, the structures of the face is coming to front, right? Like we have a hand in here. So we have resistance for the upper muscles of the smile, and we lost resistance, we lost volume on the way of the lateralizators muscles. So the smile started to be to the sides and down, just because we change the shape, we change the function. Once I'm talking about re-educating mimical muscles, I'm talking about reshaping points where I can stimulate the muscles to work on the way creating beauty. So if we put some resistance where the muscles work by the side, I can up the smile and show better the teeth on the middle. I make myself clear? It's okay? Okay. What do I mean by harmonizing the face with the functional beauty? To create an aesthetic balance, as I said, balance, it needs to be crossed, it needs to be related with the word beauty, balance. Facial proportion plus function. I need always to put function in my diagnosis. I cannot evaluate a lip without seeing the smile, without seeing how much of the teeth shows during the smile. Because if I have less than 3 millimeters of teeth showing on the smile, I cannot put volume on the lip. Because if I put volume, I will reduce the teeth shows of the smile. And the patient is going to be not beauty when he smiles. So I need always to cross the information about function with the structures that I'm following. So the proposing is a holistic assessment based on artistical principles and anatomophysiology. My lecturing, it's more about principles and assessment than the technique by itself. So, the question is, am I harmonizing the face when I'm treating only the patient's complaints? And the difference we need to always evaluate is what patients want is what they really need. If they came to your office and ask you about something, you need to understand that you are a doctor, and you need to understand that you are an artistic doctor. And if they come and just ask and you directly do what they want, you may be doing wrong about them faces. And we need to pay attention on compromising the form by refining steps. I used to say that the form and the refining, they are different. Sometimes patients think they need refinements, like the nasolabial lines, like the tear trough, because that's what they see. They see themselves just in the front image. So they used to think that what is in the middle is what they need. They just get the attention for this. And they ask for us for the refining steps, like, oh, my nasolabial and my tear trough. But sometimes when we are putting this product in here, we are changing the form by creating resistance for the middle face. And they start to look deformed. Because the refining steps change the form. We need to pay attention on this. So, the pay attention to do not harm expressiveness. That's the reason why I want to always to associate the shape and the function. Because the changing of the function comes with the changing of shape. So, patients asking for the refinements, and they think they are good, they think they are sexy. So they think they just need refining. And then, if I put something here like they did for this Brazilian actress, when she's smiling, not beauty at all, right? But I remember you, patients knows what they want. We know what they need. So we need to systematize the evaluation of what they need. We need to organize our diagnosis in aesthetic medicine. We need to change our minds, not to look only for the, oh my God, I'm just taking so much time. We need to open our eyes to the difference between what patients demand and what patients need. And refining is different from creating form. The most part of the needs is in the form. So here's an example of the view of Michelangelo. If we're trying to refine something here, oh, look. Just refining the tear trough, the nasolabial, and the marionette. Look how deformed it is. Thinking about it. Refining steps, like in a work of art, like when we are creating the sculpture, but now we are creating a life sculpture. The human face is a life sculpture. If you carry your eyes only on the refinements, you can compromise the form and deform the patient. Oh gosh. Beauty is what has clarity and form. Clarity and form. Sometimes it's better to have a line than compromise the form of the perception of the form of the face. Beauty is what have clarity and form. So never refine when refine might to harming up the form. And then our duty is, I will run, to perform a medical procedure based on artistical principles. So I bring to you, I have just 3 minutes, okay, I will, I understand the message. I will suggest for you, from my book, make the use of the technology, but looking through the lens of the past. Observing aesthetic medicine by inspired by the classical masters. And this is the cover of my book, okay? And I bring this association of art and assessment, and I will introduce to you the 3 principles. They are not rules, okay? They are only principles. Principles of facial harmonization. First, functional axis, distribution of the light, and the principle of grace. So the aim of the 3 principles above is to systematize the assessment treatment of the face in an artistical way. It's like giving an artistical touch of our duty. So the first, functional axis. So I need to divide the face in 2 axes. Analyzing and evaluating the face in functional axis. Because the structures on the same axis share function and presentation. So here we have a face and the vertical axis. The structure in here, they share presentation and they share function. So when patient complains about the chin, I need to evaluate the other structures on the same axis. This is the first principle, because the chin is always showing in contrast of the lips and the nose. Vertical axis and the horizontal axis. The same for here. When patients ask me about the eyebrow, I need to evaluate the cheekbone, because they show together, they share function and perception. Remember when we looked for someone and said, oh, Botox face. The eyebrow too high, but too high for what? Do you remember like the evil eye, like the evil like this? And people say, oh, it's look like Botox face. Why is diabolic eyes? Too high compared to what? So if I analyze in the same functional X, I'm gonna see like the cheekbone weak for the eyebrow. This relation is important. We always evaluate one in contrast of the other. So, first case, the complaint was the nose. I just cut my time, right? So, the patient complains about the nose. Should I treat directly the nose? No. Okay. So, should I treat directly the nose? I need to analyze inside of the functional axis. And when I'm analyzing these on the vertical axis, the first principle, in front I do not see that much contrast. But on the profile, I see that she have a really weak chin. And if I treat the chin, I can change the perception of the nose. This is the reason why we need to use the functional axis, because structures on the same axis, they share perception, presentation, and the function. So, I can reaffirm that the chin and the lips and nose share presentation because they are in the same axis. The treatment for her, okay, is a difference of lighting here, but you see, I change nothing on the shape of the nose, but the perception of the nose changes once I treat the lips and the chin. Well, the big point of this, to evaluate the face in functional axis, is that treating the perception. We can treat not only the structure, but the perception of the structure. So once I'm studying functional beauty, I need to understand about the perception of beauty. What structures they're showing together. So the second is distribution of the light. This technique is not about treating the patient's complaints, but also treating the perception of their complaints. Sorry about this class is a little bit too long, but so the second is the distribution of the light. The perception of the form, remember this word I'm using a lot, the form, volume, is directly connected to the intensity of the light reflecting from the structure being assexed. So you see two circles, but here you have the three-dimensional perception, because the distribution of the light gives you this impression. But if you measure it, they are all the same size. But here you have the impression of volume because of the distribution of the light. This is really important. So we need to hand these in our works. The principle of distribution of the light. When the distribution of the light decreases, there is an increase in the contrast. So, in the aging process, we have the decrease of the light distribution, and these increase the contrasts and give the message of aging. So understanding better why the reflection of the light changing is, we have like the bone reshaped, reabsorption, the fat pads, and then the shadows come out. And our second case, third gaze plus nose. Should I feel the eyes area? So here. Should I feel the eyes area teardrops directly? Maybe, maybe not. So when I'm applying the principles, first, functional axis. The nose is here, so I can see by the neck that he have a weak chin. And the horizontal axis, where is the principal complaint, I see shadow. So the second principle, the distribution of the light, is blocked in here and in here. I see the difference, the contrast between the cheekbone area and the eye area. So the treatment was the cheekbone area, and I forgot to put in here the chin too, okay? The increase of the distribution of the light by treating the cheekbones area enhances the medial eye area through. So this is the after, and this is the before. It's changed. So we changed the distribution of the light. Oh, this is the before, okay? So we change the perception of the middle eye area even without treating these. Because the light reflected bilateral, like, clarify the middle. Okay, we have a change of the light, but you can see the effect of it. So remember our three principles. The first one is functional axis. The second one is the distribution of the light. And the third one is the principle of grace. Principle of grace. So a little bit of a history of the art. So we have this adjective used in the paintings after the Renaissance. The adjective of graceful started being used in that period to define beauty in motion. So these third principles reflect beauty in motion. Remember this. We have before Renaissance in the medieval and Byzantine age, like the paintings and the mosaic, just showing one-dimensional. And after Renaissance, we have like three-dimensional. By working with the lights and shadow, we have the perception of the form. So we need to put these in our work. And the adjective of creating beauty in motion, we will call grace, like we do in painting. So the noun grace represents the three-dimensional aspect of beauty in motion. One more example. So you see no movement, and here you see lots of movement. Include the dynamic assess before and after the treatment, always bear in mind the beautification movements after the procedures. So, what do I mean by portraying beauty in motion in human face? It's paying attention on the better afterwards. Like in movement, it needs to be better than before. So to make art, I need to make it singular. To make it the human face, what makes the human face unique? The way our face expresses our emotions. So I need to include the expressions and the movements before and after the treatments. And just to finish, sorry about the time. The case 3. Crow's feet. Should I treat the crow's feet only with Botox? If I treat only the complaint, I may create another problem. This is the patient. The complaint is crow's feet, okay? And the crow's feet in here, I think about function, about muscle, but I need to evaluate inside of the principles. And when I'm using the first principle here, I will understand that I have a shadow in here, shadow compared to the middle zone. So I have the decrease, horizontal axis, the distribution of the light during the smile shows me I have a dynamic limit for injection. The shadow area shows the reduction of the dermomuscular space in the cheekbone area. So there are not only the hyperfunction of the orbicularis, but the dermomuscular space reduction that makes it occurs. So I suggest not only using the Botox in here, because if you use only Botox in the orbiculary, we're gonna lock the smile, and that's really common for men. Okay, so I need to use together, like what I see in the second distribution of the light, in here the shadow, I need to work with volume, creating form, to re-educate this muscle. So use it Botox for sure, but the cheekbones, I use only the filler. And evaluating the smile, okay, he changed the middle, but evaluating the smile, I did not lock at the smile by using these in respect to the dynamic limit, the light point in here. Cheekbones area, 2 mL of Juvederm Volift. And good examples of harmonizing the face without harming the expressivity. So, the principles are functional axis, distribution of the light, and the principle of grace. The aim of 3 principles above is to systematize the assessment and treatment of the face in an artistic way. Details make the perfection, and the perfection is not a detail. Leo da Vinci. So if you want more information about this and about the resume of the summary of the book, please send a message for us in this mail and or for Instagram, and I can send to you before the English copy of the book is done. Thank you very much for your attention, and sorry about the time.
Thank you so much, Dr. Matheus.
I think we should change the name of this treatment. It's not filler, what he's saying. Functional beauty or facial harmonization or facial dynamics, something like this, because when we need augmentation, as you did nose yesterday, yeah, you can inject something on the bone and you can make augmentation or chin. But when we need to treat something for muscle, we inject fillers into the muscle for lifting effect, and it means functional dynamics or harmonization. But it is very difficult to teach this concept to the patients. What do you think about this?
May I do a suggestion? In my practice, I give the name of reshaping process, and I don't talk about fillers. I just do the assessment and the evaluation, talking about reshaping, and after all, they ask me how to reshape, and then I use using fillers. But I do all the consultation about function and reshaping, talking about these, and after these, I explain how I will do it.
Emily Code hakkında ne düşünüyorsunuz?
Dr. Zehra asked about MD codes, and what do you think of it?
I don't, once we are talking about making art on our duty, we cannot repeat the receipts. We cannot do the same for everybody. So I do believe that any kind of code make it easier for those who do not inject yet, but make it all looks the same. And that's not what you want. When we are doing art, when we are harmonizing, you need to think about the lip like by the proportion of the nose and the chin. We need to calculate the cheekbone by the mandibula and the chin. So there's not a rule for this. You need to study any case, understanding the anatomy and the principles of art to create the best points of injections for each patient. I believe in this, in the individualizing system.
First visit, they come to you, I am 40 years old, never touch my face, I wanna do, when they come, they say, I wanna do this. Which treatment you can start with? Which one you recommend? Botox, lip fillers, something? Do you any choice?
I don't understand for the beginning.
To you and they want to do something for face, facial harmonization. First visit, which treatment you recommend for start? You start with Botox or fillers for which area?
I used to do fillers first. It all depends, it's not a rule. Sometimes patients need like something, he have a limit of budget and he needs something like for a wedding in 3 weeks. And okay, it starts with toxin botulinum. But if I do not have like this kind of problem, if I just need like to choose, I choose fillers because I make them understand that all the anesthetic situation he have in a dynamic way starts with a volume case. It starts with the deflection of the volume and then the muscular adaptation. So I explained to it, but there's not a rule. It all depends on budget and or the social schedule of the patient, but usually fillers.